Hi, I'm Nurse Practitioner Nancy Cody. I'm here with Lori today. We're going to be doing microneedling with hyaluronic acid today for Lori, after which we're then going to do some lip filler with some Juvederm Ultra XC. So, make yourself comfortable and take a look at what we're going to do today. I'm going to lift your head and leave this anyway. Try that. Come back with me. Okay, so Lori has had some numbing cream on her face for about 30 minutes before the procedure. I'm using a BLT cream, which is benzocaine, lidocaine, and tetracaine, which is miracle. It is the best I've ever found or ever used in terms of numbing, especially for her lips, which is going to help a lot when we do her injection. So what I'm going to do now is just wipe off the numbing cream, because we can't leave that on for the actual procedure. But I'm going to leave it on your lips. And your lips, you said, are feeling pretty numb.
Mm-hmm.
Good. So I'm just taking off the numbing cream right now so that we can start the microneedling procedure. Lori has already filled out a consent form, which we do for every procedure, every patient. We've also talked about the side effects, the benefits, what to expect. I'm just going to get into your eye here. So the type of microneedling we're doing today is with hyaluronic acid. This is pure HA serum. I do two different types of microneedling, one with the HA and one that's called PRP, which is using the patient's plasma. In that kind of microneedling, I draw the patient's blood, I centrifuge it, and then that separates the solid products from the liquid plasma. Then I take the liquid plasma and we use that to do the procedure. Today we're doing the HA procedure, so we're going to use the hyaluronic acid, and that gets driven into the skin with the procedure. So I'm just getting my hyaluronic acid ready to go. Alrighty. So for the forehead, we're going to start off with the most shallow, in other words, the less deep, and just see how she does. How does that feel to you?
Okay.
Any pain?
No.
Okay. So we're going to start with this, and we're just going to see how the skin reacts and how she does. And you can see I'm going in different directions. I'm going over the same area several times. Lori's going to tell me if she gets uncomfortable at all. So you can see we're starting off to get a little response, a little bit of pinkness there, which is what we want. This is looking actually good, very good. You can see the skin reacting a little bit here, and that's just perfect. That's exactly what I'm going for. I don't want to be too aggressive. I don't want to be too gentle. We want to make sure that she gets the best results. So we're kind of going a medium approach here. How are you feeling? What does it feel like to you?
Kind of feels like a cat scratch over and over again.
Uncomfortable or tolerable?
For me, tolerable, but I have a pretty high pain tolerance.
Will you let me know if it's more than just like a scratchy feeling, if it's too much?
Okay.
Okay, so I'm just going to let that sit for a minute and see how she reacts, and then I'm going to go to the nose. This can be tender, so you let me know if it's not tolerable.
Tickles.
Want me to press a little firmer? How's that, better?
Mm-hmm.
Okay. Still tolerating? Okay.
Mhm.
Okay. You had a piercing now?
Mm-hmm.
So, okay. You still feel okay?
Mm-hmm. Kind of feels like a massage on the cheeks. It feels good.
Well, I just made it a little deeper, so it may not feel so massagey right now. You're tolerating it too well, so we're going to increase a little bit. Okay?
Mm-hmm.
So I go by how the patient responds as well as how comfortable the patient is. I want her to stay as comfortable as possible, but I want to give her a procedure that's really going to give her the most results and the most bang for her buck. So we find a good compromise. Oh, that's looking good. Okay. So you can see this side now in comparison to this side. She's had a few minutes to react to the microneedling over here. You can see there's a tiny bit of irritation here, which is what I'm looking for. Tiny, tiny little bit of bleeding, which is what I'm looking for. We want some because that helps me know that I'm getting to the below the skin where her body will send healing and collagen to the area, which is the whole point, which is going to help reduce fine lines and wrinkles, the texture of her skin, her pores. So I always recommend doing a series of 3 procedures a month apart. This would be Lori's first one. We can see how her skin responds over the course of the next couple weeks. I wouldn't do the next one any sooner than a month from now, but then we can see if we wanted to be a little bit more aggressive depending on how she responds to this procedure today. This is relatively pain-free procedure, relatively inexpensive, but gets huge, huge results in terms of the benefit to your skin, your pores, your complexion. So from the perspective of the patient, the deeper I go, the more the patient might feel, a little bit more sharper, a little bit more scratchy feel. It kind of feels a little bit like sandpaper to your face.
Mm-hmm.
Would you say that's pretty accurate?
Yeah.
So I never do anything the patient is unable to tolerate. I just don't believe in that. I want the patient comfortable the whole time and still get really good results. So now Laura's kind of looking a little bit like she has a little bit of a sunburn. That's just right. That's what I'm looking for. Just going to do a little bit more on the nose. We're going to go down a little bit though. Sometimes Lori has a rash occasionally, which she doesn't have now. I would not do the procedure if she had a rash, but she's kind of recovering from a little bit of a rash. So I'm not going to go too heavy duty on the forehead.
Mm-hmm.
All right, I'm going to let Lori take a look, see.
Well,
Did you want me to be more aggressive anywhere, or are you happy the way it is?
Looks good to me.
Okay, and then we'll see how you do. Maybe next time we'll do it a little bit more aggressively. We'll just see how you do.
Okay.
So what I'm going to do now is just cleanse the skin, and then I'm going to put a layer of hyaluronic acid, which I want to stay on the skin and to dry on your skin. So leave that on as long as you can. I mean, obviously you can wash your skin tonight, but leave it on. If it feels like it's getting dry or uncomfortable at all, you can then rinse it off. So as far as what we do, follow up the treatment, she can use any skincare products that are non-abrasive, so no exfoliating until this is completely healed. Just gentle skincare. I wouldn't put anything on the skin today, but you can use a gentle cleanser tonight. Yeah, see, your skin is already responding and recovering. So we weren't too crazy aggressive today, but we can get a little bit more aggressive next time. We'll just see how you do. How do you feel?
Good. Can't feel anything on my face. Were those wipes wet?
Yeah. Yes.
Okay, because I felt it only like down here where the numbing was. So that numbing cream works great.
So look at her skin now. Turn your head to the left. Look at here. The pores are completely gone. You don't even see them at all. Nice and smooth and even. That's remarkable. There you go. I'm going to stitch you up for your lips. We're going to do some filler to Lori's lips. We're just doing a little bit. We don't want to go too crazy. We just want to give a little natural look. And you can see Lori's lip. She could use a little bit of fullness in the upper lip. Lower lip is beautiful. I don't think she really needs any. We'll kind of see as we go. So it will be a very natural look. And today I'm using Juvederm Ultra XC. I'm not a rep for any of the drug companies. I use all different fillers. But for what we want to do today, I think this is the best bet for Lori. We have some numbing stuff on Lori's lips. I'm going to wipe that off with the white. Hopefully you don't even feel this.
No, I don't think I will. It feels like I got duck lips already.
So what I'm doing now is I'm just taking a good look at her lips naturally. Most people are asymmetric, meaning one side is not identical to the other side, and that's something I'd want to correct. In this case, Lori's lips are even. They're beautiful.
She did them.
We're just going to add just a little bit more fullness to this top lip. And then we'll see if we need to on the bottom. I think we probably do not, but we'll take a look at it as we go. I'm going to put some antiseptic on Lori's lips now. So Lori's had numbing on her lips for about the past 45 minutes or so. So her lips are good and numb. We're going to use ice anyway, just because I don't like hurting people. I want her as pain-free as possible. So I'm going to use ice, which I use before my injections. But the numbing stuff just adds that miracle. Last time we did Lori's lips, she didn't feel any of the injection at all. So just because I want her comfortable, I'm going to use some ice, and then we'll see how it goes if she needs it later in a bit. Okay. So. You tell me, is that feeling cold or can you even feel the cold?
I think so, yeah.
That's what I want.
Yeah.
All right, let's take a look here. How was that?
Didn't really feel it at all.
Beautiful. So you can see now, it's a very subtle difference, but how that upper lip on the right side is a little bit fuller. Again, we're going for a very natural look. You can see a little bit of benefit right here, which is, I think, just what we're looking for. Just a little bit. I think it's beautiful.
Oh, yeah.
So we've done the right side of the upper lip, very subtly.
Mm-hmm.
We need to still do the left side in the center, but I think we're right on track. I think it's perfect balance to the lower lip. It looks really nice.
Mm-hmm.
So Lori's lips are beautiful the way they are. She doesn't need a lot of enhancement.
Oh, yeah, it looks really good.
But now you can see we need to add some here.
Yeah, it looks really good. Yeah, it's way more like plumper from the first time. Since my lips were already like...
It has a benefit
still
of some
has-
in there.
yeah.
Patients are really afraid that after injecting the lips, they're going to be huge lips and they'll look funny and people are going to say, oh my God, what happened to you? I don't like to do that. I don't do that for my patients. I want them to have the results they want. But my goal is to walk out and nobody even knows that you had it done. You just look great.
Perfect. Oh, yeah. It's good.
It's really pretty. So we have some more in the syringe. I would suggest go ahead and look in the mirror. A little bit more just in that center there. And then we can look and see where else that you might want it. Maybe a little bit more in that one corner or something like that. So I like to let the patients look as I go so that they have, you know, can give me feedback and let me know, yes, it's exactly what I want, or I want a little bit more here or a little bit more there. So that's just what I like to do.
Yeah.
Laura's already numb, so we don't need to worry about the ice right now. So what I'm doing is I'm just feeling the filler and smoothing it. You having any pain?
Mm-mm.
So now is about the time the swelling starts a little bit. So there is some swelling there. That'll go down probably today or tomorrow.
Looks good though.
We have a little bit more, a little bit.
Looks great.
I would do just a dab in the center on the bottom, just a little tiny bit. Are you okay with that?
Yeah.
How do you like the top?
Looks good.
Okay.
Looks great though.
No lip balm, no chapstick, nothing on the outside. Do you have any mouthwash at home? I would use it for the next couple of days after you brush your teeth. Just we want to keep the mouth, which is a dirty area, as clean as possible so there's no infection that would set in the lips. Well, you're a bit swollen, but there you go.
Looks good though.
This will smooth out, but you're swelling now, so we just need it to... Let me take a look at this in the next couple of days after the swelling's gone down. And if you can, sleep on your back, not on your side or your tummy, because we don't want pressure to push the filler. What do you think?
It looks good.
Go ahead, take a look. Your skin looks very nice. See how the redness is dissipating from the skin, but it's leaving your skin super smooth. Nice. Be even better after the second one. There you go. Big difference. It now matches the bottom lip. You needed a little bit in the top.
Yeah.
I think the half syringe is perfect. I wouldn't put any more.
Is that what you did? Half syringe? Yeah. Yeah, my lips are pretty small. They don't need a lot, I feel like.
Right. So we'll see when the swelling goes down. If you need any more, which I don't think, but maybe 6 months from now. Or
Yeah.
Something like that. Alrighty?
Looks good. All right, so that's pretty much it. I can't talk too much because you don't want to move your lips right after too much, right?
You can talk.
Yeah.
But no smooching with the boyfriend too much. No heavy duty tonight.
So I have gotten my lips done in the past, like 3 or 4 years ago, and the experience wasn't as great compared to when I came to Nancy this year in January. It was pain-free. She made me feel really comfortable. I didn't have any bruising or swelling. This time, I have like minor swelling, but that's just normal because you're traumatizing the skin, so that's gonna be normal. That's part of the process. But other than that, it didn't hurt at all. The microneedling, it was very bearable for me. I have a very high pain tolerance, but it didn't hurt at all. She constantly asked me if I was okay, made me feel comfortable. So I highly recommend checking out Plaster Wellness. It's here in Roseville, California, and it is located in the same building as our services as well too. So very convenient for everyone to check out. And that's pretty much it.
So sweet.